My name is Dr. Peter Fisher. I work at the Summit Urology Group. My main office is here in Holiday, and my main operating campus is St. Mark's Hospital. Prostate cancer happens to be the most common cancer in men and still is affecting 1 out of 7, depending on who you read, 1 out of 7 or 1 out of 6 men, and still tens of thousands of men die of this disease each year. The first symptom to talk about with prostate cancer in its treatable phase is relatively no symptoms. I think that's what's so surprising to men, and the message that we try to get to the public, to address to men that they need to be screened for this disease, especially if they have a family history that puts them at a higher risk, so that they can get a prostate exam and a simple blood test. In its later stages, prostate cancer can be symptomatic by changes in urinary function or voiding symptoms, or in extreme cases, blood in the urine, difficulty urinating, or pain in the bones or skeleton or other organs where prostate cancer could spread. The screening process for prostate cancer historically has been age 50. Current recommendations are of a younger age, with first screening at age 40. One risk factor that we know for sure is family history. So primary male relatives are where family history is important. For example, if you had a father or a brother or a son with prostate cancer, that's where the target starts to be on your back, so to speak, that you ought to get checked. Typically, a PSA blood test and a prostate exam would happen for a man at risk on a yearly basis. The conventional modalities to treat prostate cancer are still radiation treatment and surgery. Surgery primarily for the right candidate is done using robotics or robotic surgery, taking a longer incision and transforming it to 5 or 6 small keyhole incisions with a faster return to normal activity. Radiation has also improved in that realm as well, that rather than doing what's called full field radiation, try and do pinpoint radiation delivered to the prostate gland called brachytherapy. It's nice to be at a place like St. Mark's where we have robotics and brachytherapy available to patients, and we can help guide them to the treatment that can be best for them.